I think a lot of optometry is actually shifting towards more of a disease-based model. A lot of the ophthalmology field is, I feel, overwhelmed in terms of managing a lot of the disease. And here we are, we're totally prepared to handle it. It's just, do we handle it? And I think a lot of the students are learning that, disease is interesting. It's something we can do that's within our scope of practice, and it's something that's needed. I mean, the reason I'm here is because of the students. I love teaching. They keep me on my toes. They ask questions that keep me interested in the field. They basically motivate me to teach them harder every single day. When you're up there lecturing, you can look in your audience or the students, right? And you can say something, and you can look at their face and you're like, "Yep, they understand." Or you look at their face and you're like, "You have no clue what I just said." Right. And so when you get that look of like, "Oh man, I have no clue what Dr. B said," that's what, gets in my head. I'm like, all right, time to rework it. You have to reword it a different way. I try to create an environment where students feel comfortable. When students feel comfortable, I feel like they excel more. So there's no dumb questions with me. You can ask anything you want at any point, whether it's in class, an email, just informally, like in the hall or whatnot. I just try to create an atmosphere where students feel at ease. And again, when they feel at ease, I feel like they just succeed a little bit more. So I teach them the ocular pharmacology course. So again, there's a lot of drugs that I teach that they have to know that, again, if they don't know them, they don't know how to prescribe them or when not to prescribe them, then they won't be able to keep up with the changing times. And it basically parlays into everything else that all the other teachers do here as well. Everything they're teaching basically applies to what they're going to be doing in the future. I mean, they're the future, right? So we have to prepare them as much as possible. And that's what it comes back to when I said earlier, I basically just work for them. So the better they are, the better the whole profession is in terms of taking care of our patients, advancing the profession. Again, the better prepared they are, the better off everyone is.